Gurb Magat agus Tá Cointas Glas Sásta Takeíocht the Horth and Rún Shaw. I would like to commend Deputy Donnelly for bringing forward this motion, and the Green Party is happy to support it. Something I've heard time and time again from women who have experienced our maternity services is that they were surprised by their lack of choice in their birth plans. From a midwife-led approach to home birthing, the support options simply aren't there for most people. This is backed up by research conducted by the Association of Improvement in Maternity Services in 2015, which found that only 5.5% of women had the option of midwife-led care available. We need to ensure that expectant mothers are comfortable and properly cared for. To do this, we need to properly resource our maternity services, particularly community-based ones as called for in this motion. We must also look at our maternity services in the context of women's healthcare as a whole in Ireland. I am pleased to see that the motion notes the need for women to be listened to and respected. That is key. We have seen women hurt time and time again when it comes to healthcare provision in this country. The cervical check scandal, the practice of symphysiotomies, damage from vaginal mesh, the list goes on. I would hazard a guess that most of us in this chamber know someone who has endometriosis, a condition that is estimated to affect 1 in 10 women. However, there are several studies which point to a diagnostic delay in treating endometriosis. One reason cited for this is the normalisation of the symptoms, the diminishment of the pain felt. This and the other issues in women's healthcare are symptomatic of a wider problem, wherein women's voices, choices and experiences are all too often overlooked, undervalued or willfully ignored. It's a harder task, but if we want to ensure women are truly at the centre of maternity care, we need to listen carefully to the experiences of women and enact care guidelines that take women's voices seriously. One thing that isn't explicitly outlined in this motion, and something that does need to be addressed, is the challenge facing migrant women within our maternity services. According to the second report of Confidential Maternal Death Inquiry, women born outside of Ireland accounted for 39% of all maternal deaths between 2009 and 2012. Despite this demographic, only accounted for 24% of all women given birth. We need to ensure that there is true equity of service for all women in maternity care. What is particularly important in this motion is its call for timeframes and implementation regarding funding, resourcing and enacting of strategies. A recurring theme across healthcare service is that consultations are held, strategies are drafted, but no timelines are stipulated and no funding streams are identified. We know what staffing we need. We often know what the challenges are. What we need now is action from government. And this isn't particular to maternity care. This is in mental health care, primary health care, emergency health care. It's right across the board. We don't need more documents on shelves gathering dust. We need resources on the ground.